Lung transplant is a very difficult concept to get your head around. It's really more than an operation, but it's, what I say is that it's a trade of one disease for a new one. And the operation itself is but a tip of the iceberg of all of what's to come.
I'm Diane Williams. I'm 63 years old, and I had my lung transplant 2 weeks ago. Today. Wow. It's remarkable. My diagnosis was idiopathic pulmonary fibrosis, and that is the scarring of the lungs. And I've been dealing with this for about 15 years. And I am a special education teacher for 39 years, and I taught developmental kindergarten for 30 years, which is a lot of high energy. And I was able to keep up, nothing too bad. As it got worse, I started having to have oxygen for nighttime because my oxygen levels went low. Harder to participate in everything I wanted to, like dancing, etc. And then I hit a wall. And that happened this winter.
The idea was then explored for a lung transplant as a next step in therapy for her.
Between her, with the workup process when we first met her, through the time that we were actually able to list her, and then on to transplant, Diane was herself all the way through. She was incredibly hopeful. Nervous, obviously, about the testing and getting everything done.
And she was put on our waiting list in June of 2014. And she came in just about a month later for her right single lung transplant.
On July 16th at 9 o'clock at night, we're watching the Discovery Channel. Nobody calls us at 9 because we go to bed. It was about 5 to 9. We're watching about these elephants. And the phone rings. It's my cell phone. And I'm like, call me. I pick it up, and this voice says, Diane, this is Allison from Loyola, and we may have a lung for you. How soon can you be here? And I looked at my husband and I went, when they pulled the breathing tube and I took a breath, first I talked and then I took a breath, I couldn't believe it. I haven't breathed, and that was in the ICU. And it surprised me. I took that breath and it was like, whoa, still a little shaky. And then I found out that you've been breathing badly so long, you have to learn how to rebreathe normal again. But there was none of that, that you cannot take another breath. It was something I will never forget.
We all can't understate how important it is to breathe well. And a common mantra among patients with advanced lung disease is, when you can't breathe, nothing else matters.
I love Dr. Dilling. The way he talked to me, he told me everything about what was going to happen with the lung transplant, what could happen, what I had to do, what his job was, and it was all very understandable.
Ms. Williams had a very, very good recovery from transplant, the kind of recovery that we hope all patients will have.
I love being at home. I love being able to just make my own breakfast, walk to the mailbox. That's where I am right now. This is my first week at home. I didn't enjoy being at home for a long time because I couldn't do anything. I want to do the laundry, and I folded a basket of laundry the other day and he thought I did too much. But it felt great to be contributing to my home. It has been 5 months since I had my lung transplant on July 17th. And in those 5 months, it has been quite a building process of getting stronger. I've been going to pulmonary rehab 3 times a week, and I've graduated to phase 3 where you are more independent and can do more things. I went from 300 steps in a 6-minute walk to 5,000 steps in a 6-minute walk in that 5 months. And I mean, it's just phenomenal. I can walk around the block. I've gone shopping.
She also had a complication of an acute rejection. It was about 2 or 3 months after her transplant, during one of our routine tests called a bronchoscopy, where we take tiny biopsies and cultures to look for either infections or rejection in a person recovering from a lung transplant. It wasn't even because she was having problems. It was simply a scheduled test. And that biopsy showed that she had what we call acute cellular rejection. And this is the type of rejection that happens somewhat commonly after lung transplant. About 30 or 40% of patients will have an acute rejection.
I can't say I was depressed or down about it, but I was like, well, darn. Went to the hospital, did everything I was supposed to do, came home, took it very easy, and psychologically, I just never ever was, I just felt like I can get through this, we can do this.
She was treated with extra doses of steroids for a few weeks, and on a follow-up bronchoscopy a few weeks later, we learned that the rejection had resolved itself, and there was no longer that concern.
The side effects that I've noticed from the steroids and the Prograf and the Cellcept are swelling of your legs, arms, feet, hands. My eyes, I believe, are affected by the steroids. They swell, and when you do your spirometer test, which most people with respiratory issues do not like the spirometer test. It is really hard. And I pop my blood vessels, and then my eyes get bright red. And, you know, it's something that we deal with. Waking up with a headache by, many of the drugs have the same side effects. And so you wake up with a headache quite often, but that goes away as everything is working through your system. And we have a lot of tremors. My handwriting kind of went south for a while, but it's improving as time goes on.
It finally it sinks in that they can't, that life isn't going to go back to what it was before they got sick, but that it's going to be a different new normal, and most people learn how to live with that or manage the symptoms.
I learned in therapy that when you wake up and you sit on the edge of your bed, you should take 3 deep breaths, cough real hard, and that's how you should start your day. So that's what I do before I get out of bed. And I have to take a first medication for my thyroid at 7:30. And, you know, this is pretty precise because your 8 o'clock meds have to be 12 hours until your 8 o'clock meds. And in that time, you have to take your blood pressure, your oxygen levels, your blood sugar. You have to do your breathing test, your weight. All of this we chart. We have to chart this every single day and see what the trends are doing, if everything's going well. And then that usually takes until 8 o'clock when I take my first 8 o'clock meds. And that was at 24 pills. That's a lot. A lot of it's anti-rejection drugs. It's something for my heart. It's down to 21 now. So, you know, it does go down. It's okay. And there's a 4 o'clock medication schedule that you have to take, and then the very important ones are 8 o'clock at night. It is such a relief to not cough, to not have to have the oxygen on, to be able to, basically you have to be careful, but you can go free. I go to the grocery store. I don't go to church because it's too big a crowd yet, they're telling us. My immune system is compromised, and I wear a mask outside and in public.
So in the visits when we see patients in the clinic after their lung transplant, visits that we continue for the rest of their lives and the rest of my career. We are really focusing on all of the systems of the body because side effects and medical complications can occur almost anywhere in the body as a result of the drugs that we use to suppress the immune system.
After the transplant with now my post-transplant coordinator, the calls are, I mean, you have a question, you have a concern, everybody gets back to you, they discuss things with you. They listen to how I feel, I listen to what they recommend, it's just a very good working relationship. I can't say enough about it. In fact, when I talk to people that need a lung transplant and they're not going to Loyola, I'm like, what's wrong with you? Today it has been 7 months and 2 weeks since my lung transplant, and I'm here today for my clinic with Dr. Dilling. I've had a chest x-ray done already. They take your blood work is done to see how your levels are, and I had my pulmonary function test. I haven't felt this good probably in 5-10 years, and I just have so much energy. It's, like I used to be. So it's pretty incredible. I'm amazed every single day.
There's a certain comfort that comes as usually patients get anywhere from 3 to 6 months out, and then they start to get a little more comfortable with what's happening, and that's where it's easy for them to get a little lax about checking blood pressures every day and weights and the vital signs we ask them to do their daily breathing. And Diane was fully committed to testing every day.
So I can't really say that the side effects affect my life. They're just kind of there, and the swelling in my legs to me is the worst because I've never had swollen legs before. And you take off a sock and you got this big ridge, and like, what is that from? But I think that is almost for me the most uncomfortable, and it's not all the time. It's just there. It's like a little nagging thing once in a while. There's a lot of skin issues, some like rashes that occur, but they mysteriously go away. Easy bruising, you bruise. I would get bruised from a Band-Aid. I walk into a grocery cart and it's like this egg on my leg, and so you're very sensitive to that kind of thing. My fingernails were really clubbed and just really painful for my toenails. That's all like disappearing.
Got some skin issues that are going to be big. And so in those follow-up visits, as we're talking through all of the difficulties or symptoms that they may have, we also review their medications and find out that indeed they're taking all their medications.
I want to start gardening and riding my bike, and I want to start going places. I haven't been able to go anywhere, especially because I was lugging my oxygen around so much and I could not go any place.
So traveling, we don't have a problem as long as the patient is stable and we're not dealing with a recent rejection or infection. A lot of it is patient dependent.
I've started to compose my letter to the family because they wanted us to wait 6 months to a year. And you have a lot of thoughts that go on. And boy, sometimes I just feel so sad, that I'm feeling so good, living so well, and yet someone, but they gave us a gift, and I just think it's the most wonderful thing.
At times, I think most of our patients realize it's less about guilt. It's more about appreciation and recognizing that someone didn't die for them. Someone died. And we are able to take a tremendous tragedy, a tremendous loss in the lives of other people and allow that to benefit multiple recipients.
What a gift I got. And it's a good one. It's a good one. Today is Wednesday, January 20th, 2016, and it has been a year and a half since I had my transplant on July 17th, 2014. I have never felt better in the last 10 years. It's amazing everything I'm able to do, and I can stand, I can climb stairs.
It's quite frequent that a person continues to get better and improve their function and strength even beyond the year mark after their transplant. And so, as is her case, especially by utilizing pulmonary rehab, by being diligent in exercises at home.
The further our patients get out from transplant, the more routine it becomes. And as we all know, with any routine, it's easy to fall to the wayside. So it's easy to say, well, I don't need to check my blood pressure today. I know it's going to be fine. Or I don't need to check my breathing tests, every day this week because it's been great. And so the idea is that we're always vigilant as a team about what's happening. We need our patients to do that kind of stuff at home, is to maintain that front and that awareness so that we can make sure that we manage problems early on.
The hardest part has been to stay on the routine of your medication, your exercise, the way you prepare your foods and what you eat. That is really the hardest part because it is constant. And most of the transplant friends that I have say that they want to be normal. And we always think back to before the transplant and toting the oxygen around. Now, I could not walk from this room to our powder room with oxygen, but I would go down into the 50s with my levels. That's not normal. All of this is normal. We deal with side effects. That might be the second hardest thing. We have trimmers. Mine aren't horrible, but it's hard to thread a needle, and you'll notice it if you're putting your hand up over your head to put mascara on.
The support team, so family, friends, caregivers, are an essential part of this process. The way I describe it is this whole thing is a pyramid. At one corner you have a patient, the other corner we have the support team, and the other corner is our team, our transplant team. If one of those parts quits, the whole thing falls apart. It's driving back and forth to visits. It's when a patient needs to be hospitalized, who's going to get them here, who helps them fill their medication box if they need help. Who supports them through those moments where they say, I don't want to do my testing, I don't want to take my medication.
Because I was so dependent on them before the transplant, it was more difficult for them to not be hovering over me constantly and letting me do things for myself. David was very protective of making sure I had my mask on, which was good because at first you don't think of, I'll walk out the door and you just didn't think about it.
Seeing Diane recover and thrive the way she has, seeing Diane return to a normal life the way she has, and seeing Diane do all of this with a smile and a positive attitude gives me a lot of warmth.
Diane is energy, is the best way to describe her. She is full of light and hope and takes everything on with every fiber of her being.
Truthfully, I don't think you could do this without your transplant coordinator. Can I say Erica's name? Erica has been with me every step of the way. She explains absolutely everything I need to know. And if there's a question, I can call her, leave a message, email her, talk to her on the phone, and it is resolved. Dr. Dilling is one of my heroes. I think that what he and the lung transplant team do they're marvelous.
We're encouraged and warmed by the stories like Diane's. Those are the stories that make us realize this is why we do this. Those are the stories that keep us going to save the next person, to find the next Diane.
I would hope that if I was in a position where I would be transplanted or would need a transplant, that I could have the tenacity and the excitement and the commitment and the power that Diane carries. And she is She's unique in that she's a representative of a very special group of people.
We went to a wedding in September, and the day I danced all night and danced a blister on my foot, which I was really proud of. And the next morning we were in the bride's father's room. He had a deck on looking over the lake, and we had Bloody Marys. Mine was a Virgin Mary. And I spilled some on my blouse, and I said, "This has been a perfect wedding. I have Bloody Mary on my blouse and a blister on my foot."